Diagnosis, how we diagnose is the GARD common. Most of the time you don't require investigation. Clinical clues are there. Typical clinical diagnosis is empirical, the symptoms of the patients which are coming after ingestion of the food, after going to bed, or patient going to the supine position, he starts getting heartburn or the reflux of the gastric content. This is a clinical diagnosis. Another clinical diagnosis to prove that you give a therapy of PPI inhibitors, proton pump inhibitors, which will decrease the acid content in the stomach, decrease the pH, and it will prevent the symptoms. So if you give PPI to the patient and patient feels better, then you prove the diagnosis indirectly that patient has a GERD. But if you want to prove it theoretically on paper, you have to go for an endoscopy. Endoscopy is indicated in alarming symptoms when you are giving PPI and patient is not responding to your treatment. Sometimes patient are need to undergo 24 hours pH monitoring. The esophageal pH will change as soon as the gastric content start rushing into the esophagus. And esophageal manometry is the another method which is theoretical, but that is the gold standard. So this is how we diagnose: clinical and sometimes endoscopy, esophageal manometry, and pH monitoring. Management strategies: you should not immediately rush to the drugs. You should first give importance to the lifestyle of the patient. He should achieve near normal weight. There should be enough gap between his dinner and going to bed. Patient should avoid afternoon snacks, which are very pertinent for developing GERD. Then, if patient does not respond to lifestyle modification, then you can think of giving pharmacological therapies. Pharmacological therapies, there are older drugs like H2 receptor, like ranitidine and cimetidine, but there are newer drugs like proton pump inhibitors, which all of us must have heard, like pantoprazole, rabeprazole, omeprazole, and esomeprazole. And there is a new class of drugs. What they do, they increase the GI motility. The stomach contents are emptied earlier, so there is no more regurgitation. Those are called as the prokinetics. Important of them is like levosulfuride and acotinamide. They are commonly used nowadays. And if patient is refractory to all these things, patient is not responding to the symptom, patient is developing repeated GERD, patient has dysphagia, patient is having weight loss, patient is having hematemesis, then you have to think of surgery. There are 2, 3 surgeries which can be done. One is called as a Nissen's fundoplication. What we do in Nissen's fundoplication, we just tie the lower end of the esophagus with the small sutures. The esophageal opening becomes, which is lax, becomes normal, and there is no more regurgitation. There is another device which is called as a LINX device, a magnetic sphincter, which is put into the selected patient, and that prevents the opening of the gastroesophageal sphincter and prevents the regurgitation. Then when we treat this GERD, we have to also look for the complication. But why GERD is important? GERD does not remain only to the heartburn, because there are some complications which are really dreaded. There are simple complications like erosive esophagitis, Barrett's esophagus, but once patient passes the stage of erosive esophagitis and he is not treated, he can go into Barrett's esophagus. Barrett's esophagus, why it is important to diagnose Barrett's esophagus, which is diagnosed by endoscopically? Because Barrett's esophagus is a precursor of esophageal adenocarcinoma. Some of the patients with Barrett's esophagus, if not treated on time, can land up into esophageal adenocarcinoma. So we should carefully look for Barrett's esophagus and we should start treating it aggressively. And then there are some respiratory complications. As I told you, some patient of GERD will only present with chronic cough because the gastric content come up from the stomach, migrate to esophagus, and some particles do enter the respiratory tract. And these patients typically develop cough, which is on lying down, maybe in the night time, maybe in the afternoon. And they have chronic cough which is do not respond to anything. Like you give antibiotic, you give cough suppressant, it does not respond. The treatment of choice again is to treat GERD. So GERD is very important because clinically it is very prevalent in our country because obesity is increasing. Sometimes it can be missed for, or heartburn can be missed for GERD. Sometimes heart attacks are missed as a GERD. Sorry. So we should be very careful in dealing with the patient of GERD because sometimes even it leads to malignancies like adenocarcinoma. So this is about GERD from modern medicine point of view. I am ready to answer if anyone has any question.
Okay, sir. Question answer will be taken. We will discuss it later
Okay,
after
madam.
presentation of all experts. Then, thank you so much, sir. So, sir, give us message like first is lifestyle modification. In Ayurveda, we can say as a dinacharya or rutucharya. Then next is pharmacological therapy, means medicinal therapy, and last surgery. Right, sir? Yeah. So thank you so much, sir. Please stay with us. Now, next is Ayurveda expert, Dr. Yogesh Badwe. He is professor of Department of Medicine, Shalya Tantra, Department of Shalya Tantra from All India Institute of Ayurveda, New Delhi. Sir, welcome. Yogesh, sir?
Sir?
Yes, sir.
Am I audible?
Yes, sir, you are audible.
I congratulate first thing Rakhi for her nice presentation, and also I appreciate Dr. Chitre sir has a very good presentation, and he has explained almost all the aspects of the modern even medicinal as well as surgical treatments. So it's very good. Now we are coming to the Ayurveda. As per the Ayurveda, it is known as Amla Pitta. So Amla Pitta, which is almost in all the our Sahitas, that is Bruhatri, it is explained, it is not explained. But after Bruhatri, Madhav Nidan is there. And after this, in this Madhav Nidan as well as some Bhav Prakash, it is explained that means previously some diseases were not explained in many main Sahitas of our Ayurveda, but later it is included. So the maybe it may be concluded that there may be a chances of this disease is more prevalent in afterward. So not present in 2000 years back, but maybe present after 10th century afterward. So this mainly is depend on the first thing is your lifestyle, and secondly is your diet. So what kind of diet should be taken? First thing, she has explained that there is the patient was doing night shift also. So in this night shift, there is a uh, this may increases the acute affective disorders. So this is the important thing. And it should not be that we should advise the lifestyle change. So how he can avoid his duties? He cannot avoid his duties, but we have to follow some Ayurveda guidelines. So first thing is diet. Spicy foods like eating the samosa, burger, pizza, and all the spicy foods that is in Saudi and non-vegetarian foods, which is more prevalent in Vidarbha, also Kolhapuri masala. Okay, so this should be avoided. Then salty and sour foods, mainly the packaged foods, should be avoided. Then early instant foods should be avoided. Excessive intake of oily foods, then pickles and other should be avoided. Then food and beverages, hot food and hot beverages also. This should be avoided. We can say that the soups which are available from market ready to ready to do soups, this should be avoided. Then this intake of the continuous intake of tea, coffee, and this is the thing. Then smoking and other habits also should be avoided. Then irregular meal times, repeated food intakes, incomplete food like taking a non-vegetarian pizza followed by milkshakes and other things. These things are also food habits, which we can say. When there were some people always eat with the food, they take Pepsi and other things also. So this can these things are positive factors for this GERD, or you can say as Amla Pitta. Then eating too late and in the night. So these are the things which may contribute in the as a etiological factors. Then as per Vihara, that is regimes, so lack of rest, fast-moving lifestyles, that is hurry, worry, and curry. So both all those things, three things were, you know, all are important. Then sleeping immediately after meals. So this should be the thing. Then separation of natural urges, excessive exposure to the sun and fire. Then some mental factors are also explained in Ayurveda. That stressful lifestyles, then excessive anxiety, worry, jealousy, anger, fear, job dissatisfaction. So these things are may contribute for the GERD. Then uh, other causes like suppose some people who are living in Anuppur Pradesh, there is some Bengal and West and coastal regions. So they are more suffer with this. Then addictions, then prolonged intake of other insects and other things also may causes the increase in the pitta dosha. And with this pitta dosha increases the sourity of this mucosa, and because of this excess soreness, it is known as a amla pitta. That is, it becomes more sore. That's why it is known as a amla pitta. The same, as per the Ayurveda, the diagnosis is as same. That is some Nishtadda Jirna is there, Adhman is there, Aruchi. That is the patient does not have means taste will not be there on the food. Then regurgitation is another symptom which is also mentioned in as per the Ayurveda. It is also mentioned as a heartburn, as well as gale dah, that is gale and uro dah. Gala in the throat as well as in the chest, there is a dah, and this known as a amla pitta. So these kind of symptoms if occurs again bloating, that is indigestion and bloating is another symptoms which were explained as per Ayurveda. So this is a clinical diagnosis as per most common patients are there. And looking into the etiological factors, the diagnosis can be made. And as all the etiological factors I have said, so like that the prevention is better than cure. So according as per the Ayurveda, and we have to prevent this disease, especially mainly with the ahar and vihar. Ask the patient to avoid these excess salty, oily foods and untimely diet, then avoid the smoking and alcohol, then include in their food that is barley, old rice, green gram. So this is more beneficial for these kind of this kind of pitta diseases. Then the bitter gourd is one of the important pathya for this. Then mashed ash gourd, bitter gourd. All these are the pathya for this. Then overcooked should be avoided. Overcooked diet or 2-3 times overcooked or over fried 2-3 times fried. This should be this kind of avoided. The mental relaxation technique for this, the patient must be suggested that yoga is one of the important, as well as pranayama is one of the important thing for the mental relaxation. And this yoga and pranayama must be included in the treatment. So this is the important thing. Then other Panchakarma therapy and Ayurveda is also having some remedial therapy, that is Aushadhi Chikitsa, and there is another is the Panchakarma therapy. So as per the Ayurveda, Aushadhi Chikitsa, the patients what type of Amla Pitta is there, that is there, it is known as Urdhva Amla Pitta as well as Adho Amla Pitta. These are two types which were explained in the Ayurveda text. Urdhva Amla Pitta as well as Adho Amla Pitta. So these other than Vata, Pitta and Kapha, these three are also explained. As per the Doshik predominance, Vata, Pitta and Kapha, it is also explained. So if there is a Vataj entity, the pain will be more precedent. with that is epigastric pain or colic type of pain will be there. While in Pitta, the throat, burning of the throat, heartburn, these are the more symptoms. And while in Kapha, that is belching as well as the nausea is more predominant symptoms. So as per the this avastha, patient has to be given the remedies. Mainly the Yashti Madhu, Shatavari, Amalaki, Shunthi. These are the important single herbs which can be used. Then other, as per the Ayurveda, there are so many medicines which are recommended in these kind of disorders in this GERD or Amla Pitta. That is Kam Rudharas is more important and the Sweet Shekhar Ras. But Sweet Shekhar, whenever there is a Samata, whenever it is required, the digestion is required, at that time you can use Sweet Shekhar. But whenever the digestion is proper, but the that is Nirama Pitta is there. Nirama Pitta is there that you can use the Kamdudha, Pravaya Panchamrut. Then other Dhatri Loha, Shankha Basma. Whenever some ulceration is there, then you can use the Dhatri Loha, Shankha Basma. Then the Swarna Makshit Basma. And Amla Pittantak Loha is also there. Then some Narikelu Lova and Patoladi Kashai, Bhulimbadi Kashai. So which are these are the medicines which can be used as per the as per the avastha of that patient. Then there is a Avipattikar Churna, which is also helpful for the Urdur type of Amla Pitta. And so these type of medicines are useful in acidic disorders. In whenever it is required, means it is a chronic type of patients in this type of patients. So after the investigation, proper investigation, thorough investigation, after endoscopy and all this thing, the panchakarma, that is woman, may be suggested in these kind of patients. So after woman then the shaman aushadhi should be given for longer time. Then the patient will feel better with this and get the relief from this disease. So thank you.
Okay. Thank you so much, sir. Message from sir is etiological factors. There are many little things in daily regimen which should be avoided, and like hurry, worry, curry, we should avoid. Then junk food, coffee, repeated food, we should avoid. Then drugs. In drugs, Shunthi, Shankhavasma, Jeshtamat, etc. drugs are given on these conditions. Sir, is there any limitation to treat such kind of cases? Is there any limitation?
As sir has explained nicely about the surgical intervention, whenever the surgical intervention is required, or you may means if surgical intervention is required, then this is the only limit.
Yes. Okay, okay, sir. Please stay with us. Sir is Dean at All India Institute of Ayurveda, New Delhi, and in spite of his busy schedule, he is with us to guide our MUHS student. Sir, please stay with us. Now we have expert from homeopath, Dr. Swanand Shukla. He is professor and head of Department of Homeopathic Medicine from Motiwala Homeopathic College, Nashik.
Good evening, madam. Thank you very much for to the MHS and to the madam for giving me this wonderful opportunity. Good
Welcome.
evening, everyone. Can I share my slides over here?
Sir, not visible yet.
No?
No, sir. You can share again, sir. Again share.
Just a couple of minutes, madam. I will be joining very soon.
Okay, sir. Okay, thanks.
लॅपटॉप मध्ये ओपन केलं
Hmm.
स्लाइड
Hmm.
ओपन होईल.
Hmm. Okay, ma'am, I'm right now at Ghati Medical College, Aurangabad for my other confidential duty, but I could not join my screen, but I will definitely discuss about this matter, and I really congratulate Dr. Rakhi for presenting such a wonderful way. Meanwhile, my assistant will help me out if we can join this content. Come on this side. So a wonderful presentation. You have gone with the whole case, detailed case study as such, and definitely GeoRD is nowadays becoming one of the very crucial problem. And maybe the reason is, what we are having nowadays, a stress and strain. That is one of the very important thing what we have to go with. I think that stress strain is playing a role. And another one is, our food adulteration. What kind of food we are consuming nowadays, we are doubtful about those points. So it is very important thing that maintaining cause, we have to find it out. In homeopathic language, we call it as maintaining cause. If suppose I'm not paying attention to the maintaining cause, it is like I'm putting the wound is there only, and I'm putting some other material which will aggravate the wound. So we have to find out one thing, that how. Leave it. I will go with this one. Leave it. So I will start with my content. I can share your PPT on your group also if required, otherwise. So definitely when we are talking about GeoRD or GERD, what we call it as, it is a very common condition. People may come with a different manifestations, like some people are coming with the sour eructation. Some people feel, there is a heaviness in the chest. Some people come with eructation. Some people come with hiccups. Some people come with a bloating of the abdomen. So the presentation is, vary from person to person. And definitely you'll find it is a kind of a chronic condition. In homeopathic language, we divide cases into acute and chronic conditions. So acute conditions, when the complaints are getting exaggerated, that is the acute state. And we are having a chronic state. So we have to think the medicines in that proper way. So has already talked about the spicy oil, fried food, excessive days. Nowadays, people are going shops and people are enjoying, some other beverages. And so this kind of chocolates nowadays, they're brownie and other things. So when you make inquiry to the patient, you'll find a varied degree, and how their complaints are getting aggravated, we have to ask, because it is individualized, and homeopathy pay attention to individualization. So some people talks about that milk aggravates their complaint. Some people talks that fenugreek methi is aggravating their complaint. Some people are talking about the chana dal is aggravating their complaint. So that variation is there, and I think that is.
Sir, I think there is network issue. Okay, till then, we will continue with question answers. You can ask your questions. Two experts are with us. So if you have any query, you can ask. Dr. Rakhi?
Yes, ma'am.
Do you have any query regarding your case? You can ask. We have two experts with us. Dr. Swati will join us. Yeah, sir.
Yeah.
Yes, sir.
Yeah. So dietary factors are wonderful thing, and then lifestyle, Jivan Shaili, that also defines. So I talked about the, some drug addictions like smoking, alcohol also leads to this kind of condition. And medical conditions like everyone knows, hiatus hernia and several other conditions are there. Medications, very important point is medications. When we are doing medications without much concern of a doctor or something like that, that also aggravates the complaints. Then we are having the very important part, that is how we have to explore our patient, what kind of symptom he's coming with, whether it is a regurgitation, whether it is a heartburn, whether it is a dysphagia, whether it is a odinophagia, whether it is a chronic cough. One of my patient came with just cough, and mind you, he has been treated with so many medications. And mind you, it was a nocturnal, what we can say, reflux he used to get, and now nocturnal cough he was having. So we are having medicines for that, these homeopathic medicines. And definitely these nocturnal refluxes are also very important. Then the risk factors, everyone said obesity, alcohol, dietary triggers, and other surgical conditions are there. So here, very important thing, we have to pay attention. It is a general examination and particular examinations we are going with. If you go through Hutchinson and Goldwall and other books, you'll find there is no much finding you'll find in the this GORD, maybe slight tenderness you'll find during the palpation of abdomen. But yes, definitely we have to find out the obesity level. That is how we can find out waist circumference or BMI. Signs of anemia is also very important, where there is a chronic blood loss is there. And the general appearance of the patient is also very important. We can find out obesity, we can find out anemia, we can find out in the process of chronic regurgitation, there is a halitosis. Halitosis means a bad odor from the mouth. And sometimes you'll find, if you'll examine the teeth of the patient, there is a dental erosions, and that is also caused due to this GORD. Very important thing, how to assess this GORD. When patient comes to you, now it is your duty to say what kind of condition he's going with. So definitely we'll come with a differential diagnosis, as Dr. Rakhi has mentioned. And then we can find out some hoarseness of voice and chronic cough. So other complaints, we can find it out. So nowadays we are having so many advanced, what we can say, investigations we can go with along with our clinical examination. So endoscopy, what we are going, upper GI endoscopy, we can go with. Biopsy and histological evaluation also can be done, as Dr. Chitale has said about the Barrett's esophagus, and it is a pre-malignant condition, and one has to be, one should keep a high degree of suspicion in the mind. Don't take it casual, it is a hyperacidity, acidity, GORD, and you are giving some medications, but we have to go to this level and rule out the conditions, whether it is the Barrett's esophagus, whether it is the malignancy, and rule out the conditions like barium meal. When we are putting in a malignant patient esophagus, CA esophagus, a rat tail appearance, what we can get. So we have to rule out the conditions, and then we settle down on our diagnosis of GORD. So barium swallow is also very important investigations, what we can do with. Then esophageal pH we can find out, and with the help of that we can also find it out. And additional investigation, histopathological, esophageal biopsy, H. pylori. Nowadays you'll find gastroenterologists, they are giving, and the reports comes of endoscopy. Most of the time they are giving reflux esophagitis. That is how they diagnose on your endoscopy, and H. pylori positive also. So that is how we have to see. So very important thing is, the prevention comes first, and then curative side comes second. So preventive side, when we are saying, so it is said that the ounce of prevention is worth of, pounds of cure. So very important dietary modifications, a small meal, right? If you are taking a large meal and then there is no exercise, avoid triggering factors. So identify that unique, individualized triggering factors. Don't go win a vague, pura list bana dete, right? Stop this, stop this, stop this. Instead of that, what I feel, every individual has its own triggering factor. Identify, and for some days, ask him to restrict those kind of substances. Then reduce alcohol and caffeine and coffee and tea and other beverages. Then maintain the healthy weight. Avoid the, don't sleep, as soon as your meal is over. So there should be a gap of at least 2 to 3 hours. Otherwise, that reflux will get triggered. So most of the time during sleep and during night time, people find hyperacidic, and then they are taking some medications. So this is very important. And then physical activities are very important. 30 minutes walk. In my practice, at least, right, may not be there in the ideal text, but 30 minutes walk, really promote the this what we can say digestive process, and there is no GORD. Then fiber-rich diet, the ginger-like substances we can think of. And in homeopathic perspective, I will say again, once again, many of the time patient comes with the acute totality. So please prescribe with the acute totality. Whatever the remedy comes, the totality of symptom is very important. How it is aggravated, how it is ameliorated, what are the other concomitant symptoms. Along with GORD, the person is experiencing head pain or something else, right? Because we have to rule out the conditions. So acute totality, acute remedy. And then when patient comes for your follow-up, when the acute condition is over, right, we should not prescribe a chronic remedy in an acute condition. So it may exaggerate the condition as per the homeopathic principle. So when patient comes in other time during the follow-ups, we usually call for them follow-ups. So during that time, we can go with a chronic, very important medicines, right? So the medicines like Nux vomica stands the first, where you'll find all spicy stimulating food items. Whenever a patient comes and gives a history that they have, on the Sunday morning, misal, that rasa and tarri, and then they are coming with the complaint in the evening. So I think that Nux vomica plays a really wonderful role. Most of the, Maharashtrians nowadays, Sunday goes with their misal. So Carboveg is also another very important remedy, where you'll find that the burning, bloating, and flatulence. Arsenic album is also one of the very important remedy, but in arsenic, usually patient comes with the anxiety. That anxiety parts plays a role, right? The people comes, with the symptoms, but you don't just ask them symptom, but you try to observe them, be vigilant. And then you'll find you can identify what is the state of his mind during these complaints. And if you can identify, we can reach to our appropriate medicine. And that is the beauty of homeopathic medicines. So anxiety, if patient is coming with an anger and then doctor kuch karo iska, right, that kind of anger is expressing in front of you. So I think that comes with the Nux vomica. So that is how we have to go with. Someone is weeping and then saying that after the fatty food, after the ice cream, after that butterscotch cake with a much icing. So pulsatilla is the one of the remedy. So then we are having iris versicularis is also there, where there is a regurgitation with the burning in the esophagus. Then we are having Robinia. That is also one of the greatest remedy. And mind you, these remedies play a wonderful role during acute conditions. And you have to find out totality. You have to find out constitution. Otherwise, when there is aggravation, means these symptoms, acute symptoms will get over, and then go with the chronic. So there will be full stop to this condition. Otherwise, every time patient will come, you will prescribe Nux vomica or something, acute remedy, and patient goes back, and after a few days, again, he will come back to you. So homeopathic medicines, we can think of a chronic remedy, considering the mind symptoms, the general symptoms of the patient and the particular symptoms, and you can think of a chronic. Then we are having lycopodium, much flatulence and bloating is there. Then we are having natrum phosphoricum. Usually I'm going with natrum phos 6X, biochemic medicine. That plays a wonderful role along with, acute remedy. So 2 tabs I'm giving 2 times, and it plays a wonderful role. If you go through the literature of natrum phos through the Schuster remedy, I think you'll get your answer why we can think of this remedy. Calcarea carb is there, Calibachromicum. Calibachromicum, the pathology goes to the mucosal level, ulcerative level, and peptic ulcer-like conditions can be think of with Calibachromicum, with a viscid, vomitus. Then we are having Abies nigra, a sensation as if something hard stuck in the chest. That I'm just going with a one red line symptom and I'm moving further, because Matra Medica is vast. You can just take a stimulation from here and go back to your Matra Medica and read for once again. Then we are having anacardium, a dolichos-like remedy where there is a liver pathology is also involved. We can think of dolichos. Capsicum is there. Sir, I will require a charger. Then we are having hedrastis. So hedrastis will go with the clinical conditions like malignancy or Barrett's esophagus, what we called it as. So that is one of the deep acting remedy. Then we are having Kundurango. That is also one of the remedy having a deep pathology along with GORD. So we had to rule out the conditions. And then we are having Terminalia fibula, that is Haritaki, I think in Ayurvedic also system of medicine, this medicine is used. But of course, this is you prepared as per the homeopathic principle, attenuated in the potency, and we are using it for this reason. So some Kolkata doctors are using this remedy. And then we are having bismuthum. We are having, Raphanus. We are having Schinianthus. We are having Acalypic indica. We are having Agelus marulus. So usually what is happening, we are just living these remedies. I have just collected from Boric and Clark, and mind you, my Kolkata, some friends, right? They are also using these remedies. But one should use this kind of remedies for these conditions. And I think a very important thing is, one has to be concerned with our remedies. Before prescribing remedies, think of maintaining cost. काटा वहीं पे रखेंगे और मलम लगाएंगे, it has no meaning. So what is required is very important. Remove the maintaining cause. Then you take totality in acute condition. Don't keep asking questions for 1 hour, but I think within 5 minutes we can collect symptoms, see the state. Acute condition is so simple. Acute condition is so simple that we can see and we can observe patient. In chronicity, yes, definitely you take your time, build your totality and construct your totality and give your medicines with the right posology, and you can get an answer for this. So the junk food is one of the very important reasons what we have to eliminate from our diet. Then we are having a very important thing is food adulteration. What kind of food we are eating, or what kind of milk we are drinking. We have to go with that. So these are the points, very important points. No doubt, clinical examination, as Dr. Raki has said, is wonderful, right? We should go with our palpation, percussion, ideal way. There should be a protocol and SOP for this. And if you bring this SOP, I think we'll not miss out any conditions. So there are differential diagnoses like patients, just considering it hyperacidity and GORD hamesha hota hai, and patient landed into some cardiac condition. Or maybe you'll find GORD. I've seen our renal cases, where the serum creatinine, serum urea has raised to the maximum, and patient was not aware. And then when I asked for the investigations, I found the serum creatinine jumping more than 4, and then that was a reason for nausea, vomiting. A person came with a severe head pain and nausea, vomiting, and taking some antacids. Then I asked for CT scan, and mind you, small glial, glial tumor was there. So we have to rule out the condition. Hepatic conditions we have to rule out. So every time this GORD is not just related with the stomach and esophagus, but it has related with everything. One last point I want to make, ma'am, that is, the chana dal and tuar dal. Chana dal means kadi, bhajia, vada pav, pav vada, shev, farsan, dhokle, puran poli, and so many things are there we are eating and enjoying during the time of fast. So that contains oligosaccharide. That is a sugar, one kind of sugar, and that triggers the factors, right? That triggers the hyperacidity or GORD. So be careful. The people, you please recommend them, right, to come back to the lifestyle, improve the healthy lifestyle, go for exercise, maintain weight. And I think this is how, and very important thing is homeopathic science is such a beautiful science, right? We can individualize patient, the aggravating factors, we can find out which food is aggravating, and we can find out a pinpoint remedy. So I think, thank you once again to the Maharashtra University of Health Sciences and Gitanjali ma'am. Thank you very much. And thank you to all the participants. Still, I think 30, 35, 39 people are still there up to the last moment. So thank you.
Thank you so much, sir. He has talked about things beyond textbooks. He talked about his huge experience while treating patients with homeopathic remedies, right, sir? So he noted minute observations. Thank you so much, sir. Now, is there any question from audience? Dr. Raki,
Yes, ma'am.
is there any query?
Ma'am, I have one question.
Okay.
That is GERD can correlate with H. pylori infection, or is there any direct correlation between them?
Who will answer? Dr. Chitale?
Yeah, this is a very good question. Most of the times when we look for the peptic or a gastric or a duodenal ulcer, we always do a urease test to test H. pylori. And most of the times, this either peptic ulcer or duodenal ulcer leads to a lot of changes in the stomach pH and subsequently it leads to GRD. But GRD itself has no bearing with H. pylori itself. So that is very clear. So H. pylori has nothing to do with GRD, but GRD consequence can lead to, H. pylori consequence can lead to GRD.
Okay, thank you so much, sir. Is it clear, Rakhi?
Yes, ma'am. There was a confusion regarding with that fact, and now it has been cleared very keenly.
Okay.
Thank you so much, ma'am and sir.
One important point which I want to make, whenever we say GRD, we always think in front of our eyes of the adult population. But that is not the case. GRD is very prominent even in infants, kids, and neonates. And so many times parents are moving from one doctor to another doctor, to homeopath, to Ayurveda, to allopath, and they don't know the kid has a GRD. The moment kid is in a prone position, the kid starts crying. And the moment kid is head upright, kid stops crying. So it is very prevalent in a neonatal population as well. So we have to keep in mind whether the kid is continuously crying and you don't try to find out the reason and we start thinking of all sort of gases and acidity. It is basically GRD which is very prominent in neonatal population as well. So this other population is the pregnant females, where it is little bit difficult to treat because of pregnancy. We cannot give much of the medication, where lifestyle, posture change, and diet will really play a role.
Okay. Thank you, sir. Another query? Okay. Now
Thank
it's
you.
time.
Ma'am, one point I want to say, what Dr. Chitale said very correctly, that is one of the very crucial thing we
You are not audible, sir.
we had to see in pediatrics. We are getting. Thank you.
Okay. Okay.
I said that what Dr. Chitale has said, very correct, a very important point he has mentioned, and yes, definitely should see also every crying child is not have some hyperacidity. And one very well explained, Dr. Chitale has very well explained. So we learned a lot from his explanation, as well as Dr. Yogesh has put forth his Ayurvedic point of view, and that is also great learning. And the thanks goes to Maharashtra University of Sciences. Thank you.
Yes, sir. Thank you so much to all participants. Thanks to Dr. Rakhi for wonderful presentation. Thanks to Dr. Chitale. Thanks to Dr. Yogesh. Thanks to Dr. Swanand Shukla, sir. And thanks to all audience. So we will stop here.
Thank you, Gitanjali madam. Thank you for this invitation. It was a very interesting topic, and everyone, including Dr. Yogesh, Dr. Shwanand, enlightened from their own field and pathy. Not a single pathy is always perfect. So you have to look patient as a whole and give him some relief. Thank you very much.
So you have given take home message to all.
Thank
Thank you.
you. Thank you. Thank you.
Yeah.